Things from Apollo Cardiology. This is the office. This is the giant mitochondria that sits behind me when I'm chatting with my patients here working on their vascular health. So if you're interested in optimizing your health span, your longevity, you're going to need healthy blood vessels. You need blood vessels to deliver the oxygen nutrients to the tissues and to bring waste products away. So if your goal is to be 100 years old, or my goal 106 plus, because Grandma Ola made it to 106, I'd like to beat her record, or 120 or 180 like some people, again, you're going to need some healthy blood vessels. So if you're interested in that, listen up tonight. We got some great questions that will help you optimize your vascular health. And before we get started, I do want to announce I do have a announcement about a birthday party that Apollo Cardiology is going to be having. It's going to be August the 2nd. It's a Friday. It's going to be 4 p.m. to 8 p.m. Central Standard Time here in St. Louis. It's going to be at Shaw Park at the Enterprise Pavilion. If you're one of my patients, you may have already gotten a message about that. There will be an email going out later this week. If you're not my patient, you're also welcome. And we'll be giving away some prizes. I got a very interesting one at the end for those that actually attend. If you're interested in attending, you can send me a message here on Instagram, or you can contact our office. Cassidy or Dow will help you get all squared away with it. So that being said, we'll dive into some questions tonight. Question 1. Diet recommendations for someone with 3 stents and diabetes. All right, so it's much more important to work on your circadian rhythms than it is to worry necessarily about diet first. Think about diet as just an input to the mitochondria. So, but that being said, a good starting template is probably something that is a Mediterranean type of base. Lots of seafood, monounsaturated fats, lots of green leafy vegetables to get some nitrates in the diet. Carbohydrates are going to be based off of how well your muscles are going to be able to burn that glucose. So if you're diabetic, you're probably not going to be able to tolerate a ton of carbohydrates. So you're going to have to work with a nutritionist who's well aware of optimizing protein for your muscle metabolism, optimizing omega-3s for brain health, and monitoring your carbohydrates based off your glucose control. Next question up tonight. Interesting question. Do I lean more towards decentralized medicine, aka Jack Cruz, or centralized medicine, TIA, and why? I would say I'm more of a in-between, integrative, preventive, proactive cardiologist. So I've met Dr. Cruz before. I have not met a TIA. I've read his book. I've been following for many years, and I've listened to The Drive, almost since it came out. So I think it's always going to be in between. I definitely lean towards more decentralized. I don't work in a hospital system. I'm not beholden to the big pharma, not beholden to insurance companies. I work for my patients. A lot of what I do is just education. What's going on with your vascular system? How do you optimize your mitochondrial function? So I lean more towards decentralized. Now, where I think Tia does a good job is he does help very good frameworks to think about how to focus on optimizing your exercise routines, to think about longevity and backtrack it from there. His cardiovascular chapter in Outlive is very good. I have a few things I would add to it. His chapter on cancer screening, excellent. The goal is not to get stuck in a centralized paradigm. But if you get in there, you need to know what you're doing, or you need somebody to help guide you. So I would say I fall between it, but I would definitely lean more towards decentralized. Guidelines on how much to supplement with vitamin D, K, and or magnesium. So supplement is always that. It's supplemental to what you're getting through your nutrition and ideally your sun exposure. Vitamin D, unless you have rickets, I honestly do not recommend oral vitamin D to the greatest majority of my patients. Vitamin D serum levels is a surrogate for how much sunlight you're absorbing on your skin and turning UVB sunlight into sulfated cholesterol, which then also becomes vitamin D. So I don't use a lot of oral vitamin D in patients, or I encourage them not to use as much. I'd rather they get outside in the sun at the appropriate time of day at their latitude and make the vitamin D the way that Mother Nature intended. Now, if you're low in vitamin D, sometimes you do need some more magnesium to improve that. The body needs magnesium for about 300 to 400 different processes. You ideally need a non-oxide form of magnesium for that process to happen. Dose generally is 500,000 milligrams a day, but it's often limited by your bowel tolerance. Too much magnesium will cause diarrhea. And then vitamin K, that's going to be dependent on, do you have osteopenia, porosis, or do you have vascular disease? Vitamin K2 may help with it, but it's a little bit nuanced on the dosing. Sometimes prefer K7 over MK4. Next question up, a 54-year-old person with an ApoB between 70 and 80, so that's going to generally be around the 20th percentile. Normal blood pressure, body fat 12%. What other lab studies should I be requesting? So always kind of combination of biophysical and biochemical. So the biophysical is looking at the arteries themselves. So here in this office, we check the carotid artery intimal medial thickness. We do testing that looks at the endothelial function. Not many offices have that, and we're pretty specialized with many non-invasive cardiovascular testing gear, but the CMT is available in many cities and locales. And then a calcium score, CT coronary calcium score, or more preferably, a test that looks for soft plaque in the coronary arteries, a CT coronary angiogram with AI machine learning software laid on top of it. That's the Clearly scan. That looks at how much plaque is in the arteries, because that's what you're trying to treat. The ApoB of 70 is probably a good starting point, but you have no idea what's actually going on with your arteries. And I see Dr. Alexis, who just logged on. Hi, I just did a podcast with her about a week or two ago, and we talked about many of these topics. I'm about halfway through with the podcast that you did yesterday with Uncle Jack. I saw him do an ID Live this morning, and he was raving about you. So we definitely have to catch up offline on this one. But finish up this question. So do some things that look at your arteries first, and then biochemically. Good, you got an ApoB, but you need to look at some markers of inflammation and oxidative stress. Often check oxidized LDL, oxidized ApoB, phospholipids, or it's oxidized LDL on ApoB. There's the inflammatory markers, high sensitivity CRP, LPPLA2, myeloperoxidase. Those are more specific to vascular inflammation. And then I'll often check many labs that will have effect on nitric oxide, which is critically important at dilating your arteries and preventing things from sticking to your arteries in the first place. So those can be labs such as urine microalbumin creatinine ratio. If you leak protein in urine, you have glycocalyx dysfunction to your kidneys. Likely you have it elsewhere through your 60,000 miles of blood vessels. I would also check ADMA and STMA. If those are elevated, you're going to tend to have lower nitric oxide levels. If you have high homocysteine, you're going to have methylation issues. High homocysteine will drag down nitric oxide, mostly through ADMA. And high uric acid also damages the glycocalyx. So those are some starting points. But there's 300 to 400 different things that damage the arteries. So you want to look at how healthy are the arteries first, and then start digging into if there's problems with the arteries. Is it something in your circadian biology? Is it something genetic? We usually get to the root cause of it and then make a good plan for you. Oh, I see another one. Kelly's on here tonight. All right. How aggressive should one be in chasing a particular VO2 max level? VO2 max is correlated with longevity, but I would not be hyper focused on it if there's other things that you need to address first. Most people are not doing enough exercise. If you're trying to optimize VO2 max, you're probably not the audience that I'm necessarily always talking to, but you're going to have to get into building up a very good base of VO2 max kind of work with zone 2 training to kind of optimize the mitochondria to be able to burn more fat for energy. And then you can start doing more zone 5 where you're actually getting your heart rate up to 85-90% of your maximal predicted heart rate. Doing burst, HIIT type training to be able to do that. And you're probably going to have to do that at least once or twice a week to be able to maintain that. So you do want to be at least above average for your age. That'd be ideal. Here in St. Louis, there's a company called DexFit where you can get that done. I've done one about a year or so ago. I was average for age, but I really wasn't putting a lot of work into trying to raise it at that point. So, yes, and I do have a pretty good solar catalyst going on. Everything here, this is the office plants. I use that as an example of photosynthesis. If I cover that plant up with a tarp, it's not going to grow very well. And all natural lighting in my office, and I don't tend to use any artificial light here unless it's pitch black outside because of a storm. So, and yes, it's kind of roasty toasty in the office. It's about 95 degrees outside today. So, all right. Plant sterols like, I can't read that word, extra virgin olive oil and avocado oil to reduce LDL. Honestly, I have not seen much effect, for lowering lipoproteins with those. It may help some of the lipid peroxidation or preventing the LDL from oxidizing, which is important to not have a lot of oxidized lipoproteins, because then that activates the monocytes, the white blood cells, to basically start gobbling those things up, and potentially will start forming plaque in the arteries with that. But your next question, does it have any impact on cell membrane integrity? It's more likely it's important that you're getting enough omega-3s than it is necessarily the monounsaturated fats. Now, those are healthy fats if you want to cook with them, but focus on getting high-quality omega-3s through your diet. Ideally, you're eating seafood at least 3 times a week, and then you can monitor your omega check levels on your blood testing. And Dr. Lex is talking about a lot of avocado oil on the shelf is rancid. Would not be surprised. So, I mean, if you open up something and it's, doesn't have a, quote, fresh smell, you're going to be a little bit challenged. And, it's always a challenge to get high-quality oils. I mean, there's also stories of, oils coming from, Italy, where, obviously they're going to have very good olives. Well, sometimes some of the best stuff, they keep it there. They don't ship that over to the United States. And some of the stuff gets cut with vegetable oils. So you don't always know what you're getting. So, it's buyer beware sometimes. I did learn many years ago that, if you're stateside, getting olive oil from California, particularly like the Napa-Sonoma region, is pretty high quality. And there's a lot of regulation in California what goes into the bottle. So you can be pretty confident that you're getting high quality if you get it from that region. Question about, are pomegranate compounds proven effective in reducing salt plaque in the arteries? I don't know so much if they're proven to reduce salt plaque, but pomegranate does have an effect on HDL functionality. And if you can make HDL's function improve, there may be a shot that the plaques will delipidate in the arteries. So often, if people are going to do these supplements, I will do it if they have high myeloperoxidase, or there's evidence that they have a lot of vascular inflammation, then it may be worthwhile. But it's lower on the totem pole of things to consider supplementing. I'm always going to do the basics first. You got to get your circadian rhythms right. You got to prioritize high quality sleep. Get outside, earthing, grounding, lowering inflammation. Those are always going to be keys first. Next question up tonight. What impact does regular sauna use have in treating and preventing coronary vascular disease or cardiovascular disease? So, large population of Scandinavians and Japanese use sauna in this tradition. I got the honor to go to Finland and Norway last year to do some sightseeing to see the Northern Lights, and we got to hang out with the regulars and do a lot of sauna, cold plunging. Got a cold plunge in the Arctic Ocean, which was awesome. And so that is just built into their culture. One of the reasons is I was there when the sun's rising at 9:30 in the morning and setting about 3:30 in the evening. But 2 weeks before I got there, and maybe it was a little bit more than that, maybe like a month before I got there, it was 24 hours darkness for a couple of weeks. So the way that those people get more light into their bodies is they're using sauna to be able to do that. They're getting the infrared light into their bodies doing that. So this helps structure the water in your body. So on all the biological surfaces, you have structured water or easy water. This is the water that Dr. Gerald Pollack talks about in his book, The Fourth Phase of Water, and he has other resources as well. But that's the most kind of entry into structured water book that people should consider looking at, is Dr. Gerald Pollack. But when the glycocalyx, which is heavily filled with this easy water, is hit by infrared light, it expands. It basically stores the energy in this water network. The healthier the glycocalyx, the more it can repel the lipoproteins from sticking to the artery in the first place. So in my office, I use the tennis ball analogy as something that represents a lipoprotein. If you have a healthy glycocalyx, these things will tend to slide by more. The glycocalyx is negatively charged. The outside of the lipoproteins are negatively charged. Negative repels negative. It's kind of like a maglev train. So sauna use, 3 to 4 days a week. Get to a point where you're sweating for 20 minutes. That's probably a good starting point. I often get the question, is this, Finnish sauna similar to the near-infrared, saunas? They're different, but most of the data has been in the Finnish saunas, where it's actually like wood burning. But I tend to favor just do whatever you're going to do, get the sweat rolling, and then check something else and see if it's improving. Is blood pressure improving? Is arterial elasticity improving? Is inflammation going down? Then stick with it. Next question up, is Crestor good for lowering ApoB and oxidized stress? Otherwise, blood pressure, CRP, magnesium, homocysteine, all good. So Crestor, or also known as rosuvastatin, is something that I will utilize on occasion to help lower lipoproteins. The main one that you're trying to lower is ApoB, as you correctly noted. It will help with decreasing some oxidative stress. There's some studies that the rosuvastatin will improve the glycocalyx as well. So now dosing, that sort of depends. I will often do a Boston Heart panel in patients to figure out, are they a hyperproducer of sterols? What is their ApoE allele status? That kind of gives you an idea like what dose they might be able to tolerate. Also, we'll frequently check KIF6 and SLCO1B1. Those are two genes. If the SLCO1B1 gene is abnormal, if you're a homozygote or a heterozygote, meaning you have one or two abnormal copies, those patients tend to have more muscle symptoms with statins. So often would only use 5 milligrams of rosuvastatin daily or twice a week. If the person has a KIF6 allele that's abnormal, it increases the risk of vascular disease by about 50% relative risk, and they tend to benefit more from statin therapy. But I often tell people statins are tools. You actually want to treat the arteries. You're trying to treat vascular inflammation and plaque. What's flowing through your blood is secondarily to that. So I will use it on occasion, but you want to kind of match it to what's going on with the arteries. All right. We'll see you later, Dr. Alexis. All right. Might more sunlight, grounding, and blocking blue light, but still on rivaroxaban, lead to too thin of blood? Not likely. And now I don't know why you're on rivaroxaban. You'd have to talk to the doctors that have prescribed it. If it's a lifetime type of medication, if people have atrial fibrillation and have high risk of stroke, often it is a lifetime medication to reduce the risk of stroke. If it's for a deep vein thrombosis, sometimes patients can get off of it 6 to 12 months later. So I got to talk to your doctor first about that. But no, grounding is going to improve the zeta potential. It's going to, yes, keep the red blood cells from sticking together. And sunlight, does naturally get the blood to flow better, but it shouldn't cause it to be, quote, too thin. Next question, do I recommend omega-3 supplements? The general answer is no, it's a supplement. I recommend people get it through dietary sources first. SMASH is one of the acronyms some people like. Salmon, mackerel, anchovies, sardines, herring. You can also throw tuna in there. But the more dense ones are going to be oysters, clams, mussels. Those 3-4 times a week would be a good starting point. The challenge with supplementation is that often it can be rancid if it's been kept in improper conditions. The other challenge, more from a quantum biology standpoint, is that it's a triglyceride backbone. And if it's not in the SN2 position, it's not likely to get into the cells, particularly in the brain. So your blood levels will be high, but it may not actually be getting into the cells and doing any work there. So you want to actually be eating it through Mother Nature's kind of packaging. That's the other reason why algae oil probably doesn't work well. It's not in the SN2 position. When fish eat the algae, it converts from an SN1 or SN3 position into the SN2 position. What do I think about the studies that people with high LDL live longer? Depends on what study, but LDL by itself is not something to be really focused on. It's, do these people have significant plaque in their arteries? That is what you're trying to treat. You're trying to reduce cardiovascular events. There's also studies that people with lower LDLs, have shorter lifespans because they have cancer or they're malnourished. So I would not focus so much on one study. It's the totality of evidence that it's the ApoB containing lipoproteins that you need to modulate. All right. So I think I got through the pre-submitted questions. Those are some great ones tonight, guys. So I will put this up onto my archives when we're done chatting. I've also been putting these up on my YouTube channel, which is just drtwyman.tv. I usually release those ones on Sunday and sometimes on Wednesdays if I've kind of got back logged a little bit on them. I actually will put it through an AI filter, so it'll kind of list all the questions, so you can kind of skip ahead a little bit, and there's a transcript as well. So sometimes I know some of these words are the first time you're hearing them, but it gets a little bit easier the longer you hear these things. So my YouTube channel, drtwyman.com. I recently had a video on there where I went through my previous labs. I'm going to do another set of my labs on myself in probably a couple of weeks, so I'll do an update on that. And then I'm still meaning to do an update video on my Clearly scan on my website, drtwyman.com/clearly, and that's spelled CLEERLY. I have 2 videos that explain the process of getting a Clearly scan and what my previous results sort of look like. I am going to do an update to show you that I actually got the soft plaque in the arteries to delipidate or shrink by 6% in less than 3 years on no pharmaceutical agents. I was just doing what we talked about tonight, optimizing nitric oxide, supporting the glycocalyx, sunlight, circadian rhythms, sleep, grounding. All those things helped reduce vascular inflammation, thus plaque tended to improve. So I'll show you that on my own scans. It's my own N of 1 experiment. All right. All right, so this is a question. What are my thoughts on low protein diets in the longevity space? Supposedly triggers more mTOR. So different organs, have different growth phases. It's more of a timing thing. So I'm not a huge fan of it. If you don't have optimal protein intake, you're likely to ultimately become malnourished, sarcopenic, and then the metabolism of everything starts slowing down. So not a huge fan of the low protein diets. You can follow my friend Dr. Lyon, who can speak to it more eloquently and kind of negate a lot of their false beliefs. But I'm not a huge fan of it. And then I know Dr. Alexis had to jump off, but Dr. Alexis is a phenom. She's a PhD, trained at Princeton in Josh Rabinowitz's lab. She's an expert in metabolism. She's a friend of my colleague and friend, Dr. Gabrielle Lyon. And she's recently got kind of red-pilled, where she's deep down the rabbit hole of light water magnetism. She can speak very eloquently about the optimization of mitochondrial function, in regards to light and metabolism. So I did a podcast with her about 2 weeks ago. Her podcast is Undoctrinate Yourself. It's on all the usual stores that have podcasts. She just did a follow-up podcast with Dr. Jack Cruz last night. I'm about halfway through it. It's relatively epic. It's extremely dense, let's say. I was almost a physics major in college. I've known Dr. Jack for a few years. I've read his work. I'm having a hard time comprehending everything he's saying at this time. I'm going to go back and listen to this 1, 2, 3, 4 times and take notes. So do not worry if you listen to Dr. Jack Cruz and if you don't understand him at the beginning. That's to be expected. You're just supposed to start to pick up some meta topics. Optimizing light, water, magnetism. That's the things you got to focus on. All right. See if there's any other questions popping up. Somebody's asking, what are my thoughts on senolytics and eliminating zombie cells? Not my area of expertise. I have some patients taking quercetin for this reason. I would talk to a doctor who's a little bit more well-versed in this to figure out other options for that and correct dosing. But, the senolytics, are taking out the cells that are causing just inflammation in the system. Question, what's the mode of action for Vascanax for nitric oxide production? It's a capsule, 2 capsules once a day. It has compounds in it that ultimately will cause the body to produce more nitric oxide, as well as hydrogen sulfide, which is another vasoactive gas that dilates the arteries. The differentiator with this product is that it has the hydrogen sulfide promoting features. hydrogen sulfide acts more like kind of like Viagra or tadalafil, and it acts as a phosphodiesterase inhibitor, so it prevents the nitric oxide from breaking down. So the data on Vascular is that it has a kind of high peak that lasts for about 24 hours because of the hydrogen sulfide. All right, guys. So at the top I was talking about, if you want to live to 100, 106 plus in my case, or some people I have higher levels. Somebody today was 111. I've heard 120, and the longest I've heard anybody say is 180. Well, if you want to live that long, you're going to need healthy blood vessels. If you don't have healthy blood vessels, you can't get oxygen nutrients to the tissues. The mitochondria have a harder time making energy, and you can't get waste products out. So you got to do the things you need to do to optimize your nitric oxide production, help your glycocalyx, keep oxidative stress and inflammation low, and modulate your lipoproteins if they're causing significant plaque in your arteries. I talked about that August 2nd will be the 5th year birthday party for Apollo Cardiology. We opened in August of 2019 as a kind of thought, as a experiment, like could we open a practice that wasn't connected to a hospital, that wasn't connected to their insurance company, that was decentralized from the beginning, that would strictly focus on preventing people from having heart attacks and stroke. And fortunately, we've been able to scale up effectively. We have many patients from all over the country. 40% of our patients do not live in St. Louis. They come to visit us at least once a year, and we take care of them remotely after that. So I'm very grateful for all you who've come to see me. We're going to have a kind of a birthday celebration for that. You're invited. Even if you're not my patient, you are invited. It's in St. Louis at Shaw Park, which is in Clayton, Missouri. It'll be at the Enterprise Pavilion, August 2nd, 4 p.m. to 8 p.m. Drinks, food provided. They're going to be circadian friendly foods. They're going to be quantum biology effective foods, things that I would actually eat. I'll show you why. And there's going to be some door prizes, and there's kind of a grand prize, and I'm going to hold the grand prize as a secret. You'll have to come to figure out what that one is, but it's pretty good. I promise you that. So if you guys are interested in that, you can always drop me a comment or contact us at the office and RSVP for it. But more details, if you're on my email list, they'll be going out sometime this week. So hope you guys have a great week, and we'll see you next Monday, 6 p.m. Central Time.